Oh, all right. Hi, thank you all for coming in today. I thought it might be appropriate to talk about diet and Parkinson's at noon, since I'm sure you're all very hungry, so I apologize for any of the increased appetite you experienced during this lecture. This is something that is important for everybody, given that everyone here eats. This is important for not just patients with Parkinson's, but also any loved ones. So I just wanted to get started and talk about diet and Parkinson's. So disclosures, currently doing a research project looking at immune biomarkers in the progression of Parkinson's and Parkinsonism, founded by Parkinson's Foundation and Bacalar Generous Gift. And then my training was funded by the Michael J. Fox Foundation. So as I mentioned, what you eat matters, and it's very important what you put into your body because it can have effects on your symptoms if you have Parkinson's disease, but just in general in your overall health. So there are a lot of fads out there, and it's a little overwhelming. Which diet should we be following? Gluten-free, vegan, Whole30, Atkins, paleo, keto. Are you allowed to eat anything anymore? Yes, you can. And so just to talk briefly about the one that I would recommend, that would be the Mediterranean diet, and also the MIND diet, which is based off of the Mediterranean diet. And there's some reasons and actual studies that have supported this, in that having a diet high in monounsaturated fats such as olive oil, vegetables, fish, the omega-3, that this diet actually helps to prevent cardiovascular disease. And while your primary care doctor may warn you, you have to lose weight so you don't have a heart attack, they might not be telling you, you need to be healthy and eat right, because if you don't, you may develop dementia down the road, which I think is sometimes a little more pressing for people when they hear that information, because if you are not getting blood to your brain, then that is going to cause damage to your brain and can lead to symptoms that worsen Parkinsonism and also memory. And so the MIND diet has some nice simple recipes that are pretty easy to follow. And it basically is the Mediterranean diet plus other foods high in antioxidants such as berries. And it's summer right now, so blueberries, raspberries, it's a great season. I hope you can go and eat them guilt-free and think about you're helping to fight the progression of Parkinsonism, every blueberry, one blueberry at a time. I wanted to take the time to talk about protein in Parkinson's. It is important to get protein in your diet, as I mentioned, with fish, and then also even leafy greens have protein. But this is a little bit more of a hot topic for patients with Parkinson's, since our mainstay therapy is levodopa, and levodopa, it is inhibited, or the absorption of it is slightly inhibited with high protein meals. And so many people find that limiting the protein earlier in the day, such as at breakfast or lunch, may actually help their symptoms, since they absorb the medication of levodopa better. And we'll talk about this in further detail. So let's go back to what is levodopa. Levodopa is an amino acid. What's an amino acid? It's a precursor to protein. So levodopa is a very simple compound, what came from the Mucuna purins bean, and has been concentrated in high doses. And it's an amino acid very similar to tryptophan. So many people have heard about that, and they're reminded every Thanksgiving after they eat turkey and become a little tired. And so the amino acids in protein and levodopa are competing for the gateways into your body and into your brain. So if you have the protein and levodopa at the same exact time, there may be a little bit of, it may not absorb and feel the impact of levodopa as strongly as you would if you had eaten this medication with an empty stomach or maybe with some carbohydrates and non-protein foods. And so what foods have protein? I take this for granted. Many people know steak has a lot of protein and chicken and eggs, but also the things that I just mentioned that I want you to eat, like the nuts and the dark leafy greens, as well as milk and even avocado. So these things all have protein. And so let's talk about how to, if you are one of those patients who takes levodopa and may be sensitive to the impact of high-protein meals. And how do you know if you're one of those patients? Well, it tends to be patients who, after lunch, they may feel a slump. If they are eating cheeseburgers or something at lunch, they may feel like their symptoms worsen in the afternoon. And so a way to avoid this is to separate the protein. But if you're just starting taking levodopa, we recommend taking it with food, maybe some carbohydrates, because the side effect of levodopa is nausea. If you have been tolerating levodopa and you don't have any nausea with this medication, we recommend that you take your pills 30 minutes before eating. It's a nice way to remember to take your food or take your medications, and also a nice way to remember to eat. It is important to keep eating. And then, since the gut sometimes slows down for many people with Parkinson's disease, we recommend waiting 2 hours after. And so this is a soft recommendation. Many people seem to be having a heart attack coming in, but how do I time my meals with my medications? I'm taking my levodopa maybe sometimes every 3 hours, and I worry about their heart because I'm worried they might have a heart attack, trying to figure out the schedule. Nothing bad will necessarily happen to you if you take the levodopa with the protein. It is not dangerous. It's just that the medication will not be absorbed quite as well. So it is okay if you decide to have a spontaneous impromptu dinner and enjoy a steak, or maybe have a nice omelet with breakfast and you forgot to take your pills 30 minutes before your meal. It's okay to take them with your breakfast. I just wanted to further explain our reason for making these recommendations. And also, I don't want you to become so stressed trying to time the medication and food that you end up losing weight, because weight loss in Parkinson's is an issue. It's due to multiple factors: decreased appetite, medications cause nausea. For patients, there's increased muscle activity from the stiffness and sometimes tremor. While Parkinson's is often associated with weight loss, I still use if someone's losing weight is still, to me, a diagnosis of exclusion. And what I mean by that is I still want my patients to be having their routine cancer screenings, make sure everything else is fine, and that there's no other cause of weight loss besides attributing it first to the Parkinson's disease. The other reason why diet's important is because there are many symptoms in Parkinson's disease where your diet can actually help your symptoms. And many patients do not want to be taking so many pills, so it's beneficial to change your diet in ways to help your symptoms. Dr. Afshari talked about constipation. It is a debilitating and sometimes dangerous symptom of Parkinson's disease. I consider myself a failure if my patient goes to the ER with a bowel impaction that is preventable. The most common reason for worsening of constipation is that my patients are not drinking enough water, because it's hard to get up and go to the bathroom, and also there's urinary frequency, and so people are able to avoid going to the bathroom if they stop drinking water. So 6 glasses a day of water is what is recommended for patients with healthy hearts. Of course, if you're following with a cardiologist and you're on blood pressure medication, I would first clarify with your cardiologist how much water you should be taking in. And then the diet changes include whole grains, brown rice, leafy greens as well, fruits. It's a perfect time to be eating a lot of fruit, and then beans. The nice thing about fruit is that it can lead to hydration and without, sometimes patients will drink a full glass of water and then they know within 30 minutes they're going to be running to the bathroom. Eating melons and things high in water, it tends to be absorbed a little bit slower so that there isn't that urgency associated with the fruit. So this is a good way to try to promote hydration without sending people to the bathroom to urinate. Also, the medications are absorbed better with a full glass of water, so it's helpful to drink water every time you take your medications. For sleep, we want to avoid the sugar at nighttime. Alcohol may help you to fall asleep, but then the sleep is not as restful afterwards. So we want to avoid alcohol at night if possible, and then, of course, avoid caffeine later in the afternoon. And we will be talking about caffeine too in Parkinson's. And then finally, you can supplement your diet with vitamin D fortified foods such as milk and eggs and also fish. And so that's a nice way to get the vitamin D that you need that we may not be getting since we all live here in Chicago throughout the year. And then I mentioned berries. So medications that are anti-inflammatory include berries, salmon, tuna, and then, of course, those leafy greens. And so those can help to decrease inflammation, and hopefully that's helpful for your cardiovascular disease, meaning heart disease, and also your memory in the future. Bone health is very important since, as Dr. Afshari mentioned, falls is a problem for many people. So we recommend getting calcium and vitamin D. As mentioned, as with vitamin D, calcium is fortified in basically orange juice, which is nice. You can have a little bit of that in the morning, and then also cereals, and of course, with some vegetables and berries. They can be fortified in the smoothies that you can purchase even at the store. And so if you're not getting it through your diet, it is okay to supplement. The Center for Disease Control recommends that all people 50 to 70 take in at least 600 units of vitamin D, and then over 70, 800 units of vitamin D. And that is holds true for patients with osteoporosis as well. Though if you're seeing an endocrinologist, if they say to be taking more, I would follow that recommendation. And so going back, so fortifying your foods is important, and then just knowing too that your digestion is slowing. And so once again, can't reiterate enough, we have to be drinking water so that we do not develop bowel impactions. And one way besides constipation paste, which includes prunes and other vegetables, having a cup of coffee in the morning can help people stay regular too sometimes. And so I'd like to talk a little bit more about coffee in Parkinson's disease. So many people may feel that their symptoms do worsen with after having coffee because it's a stimulant and it's activating. However, large population studies have shown for gentlemen that drinking coffee actually reduces the risk of developing Parkinson's disease. Unfortunately for women, it doesn't hold quite as true for women who have not undergone menopause or for those who are taking hormone supplementation. However, having a glass a day is likely not to be harmful for patients with Parkinson's, although the activating stimulant of coffee may worsen tremor for those who have tremor. There's also been evidence besides looking at large populations of people to see the progression of Parkinson's in them. There have been studies that looked at biomarkers in Parkinson's disease, and those who have had low levels of caffeine and the caffeine breakdown products have actually had higher progression. And so that's another study that kind of suggested the importance of coffee or caffeine too. And then it's not just the caffeine in this mouse model that was done, but actually caffeine plus something else in coffee work together in combination and have been shown to be neuroprotective in mouse models. Of course, this has never been studied looking to see if we randomize people to coffee or no coffee, what do their brains look like under a microscope, since we cannot do that. But there is some growing, body of evidence that coffee can be helpful for patients with Parkinson's. So I just wanted to summarize. In clinic, I get a lot of questions about, well, doctor, should I be taking this? My patients are spending a lot of money on supplements. So I just wanted to go through a few of the most common supplements that I see people trying to add to their diet or thinking about adding to the diet. So I mentioned the Mucuna purins bean, and that levodopa actually was found from this bean. So should you be taking Mucuna purins? Well, fortunately, here in the United States, we have levodopa, which is a controlled dose and a stronger dose than taking in the Mucuna purins. So if you are in a far-off land without a pharmacy, maybe you should be grinding up this powder and taking it. But since we are all fortunate to be here with easy access to pharmacies, I would say no. If you are able to take the levodopa, I would just do that. Same thing, fava beans. People ask about that. You would need to consume a massive amount of fava beans to get the benefit, since the concentration of levodopa in fava beans is very low. What about vitamin E? This actually has been looked at with a DataTop study, which was conducted in the 1980s to the 1990s, looking at greater than 2,000 units of vitamin E a day, and there was no neuroprotection observed within that long study. However, 400 units, which is usually available in a multivitamin, is not going to hurt you. What about vitamin C? Likewise, it probably will not hurt you. If you're taking a multivitamin, you're getting enough. What about coenzyme Q10? Unfortunately, this was also studied, but the study was stopped early because it was futile, basically seen as futile to continue this. However, if it is within your means, once again, it probably will not hurt you, but the studies that have been done did not show that it was neuroprotective. And then this one, maybe you haven't heard of, but I've had enough questions about it that I wanted to bring it up just to answer this. Mannitol, there's a lot of excitement because there was a preclinical trial. What is a preclinical trial? An animal study that showed that mannitol could be neuroprotective. But it has not been studied in humans yet. And the reason why I do not recommend people take mannitol is because mannitol is a diuretic, a sugary diuretic, and so it's just going to dehydrate you from current understanding. Once the studies, or if the studies are conducted in humans and they support this otherwise, then I will recommend it. But at this time, I'm not recommending that people take mannitol. So this is a list of common supplements that people ask me about. The Parkinson's Foundation website has a fantastic list of supplements and diet recommendation, and it goes through the evidence quite nicely too. So I would recommend this website if you have any further questions about what you should be taking and if it's worth the money that you may be spending. Because I do have many patients who are spending almost $100 a month on supplements. So it's important to think about and also realize that $100 is $1,200 a year. That is a nice little weekend getaway that you could be treating yourself to. So just something to think about. So thank you for your time, and I will let Lucy introduce the next speaker.